An East Harlem nursing home is having no parts of any monkey business. Bill, let me show you this ID with a picture of a monkey, which was shown to a black security guard who works at the Terence Cardinal Cooke Healthcare Center. And now it has a doctor deemed as a racist, and he is barred from seeing any of his patients here.
I love joking. I love joking. Everybody knows me. This is a stupid joke.
I caught up with Dr. Richard Lewkowicz at his internal medicine practice in Midtown, who have been calling on patients at the East Harlem nursing home for 34 years. Dr. Lewkowicz says it's an old ID and claims it's a self-deprecating joke.
He said, it's a joke. I said, when I was young, I had more hair, was good looking. Now I look like a piece of whatever. That's it. Next day they called me and they told me you fired because it was a racial.
Now, the security guard who I attempted to track down says this is the second time the doctor pulled this stunt. And according to the guard, he is traumatized and has trouble sleeping at night. Now, the nursing home declined to comment on this situation, but Dr. Lewkowicz says the whole ordeal has been blown out of proportion. He said he never remembers being warned about the ID the first time. And he said, how can he be a racist when most of his patients at the nursing home are minorities?
Majority of my patients are African American. They know me for 34 years. So suddenly I became racist overnight.
Now, Dr. Lewkowicz is a part of a union, and a spokesperson from the union said, in regards to this situation, we take racism and discrimination in the workplace very seriously. Yet the doctor showed me a letter that he received from the nursing home in which they were trying to terminate him prior to this incident. He believes that they were just looking for a way out to let him go.
Well, this to me sounds like a dad joke of all dad jokes. My dad has a Curly from the Three Stooges driver's license that when people say for his ID, he hands them first and patiently waits for them to laugh and then hands over his other one.
I would easily see myself doing that.
I'm worried but like that's what I mean. Like this to me just sounds like an older guy trying to make a patient smile or a security guard smile, and it just backfired, unfortunately.